Hi, everyone. This is Samira Daswani, the host of the podcast, The Patient from Hell. Today, we're actually recording part two of the episode with Dr. Kogan. If you've tuned in to last week, you would have heard the first part of it where we talk a lot about the sort of science behind the sympathetic system, the parasympathetic system. We talk about the many aspects of the cancer experience by early stage, the metastatic population. And then we also talk about some of the themes from Dr. Kogan's book. We really wanted to record part two to cover a broader topic about stress and stress as it pertains to the cancer experience. So today's episode is going to unpack the concept of stress, how it shows up, how it manifests itself in the cancer experience, and then what are some of the ways that we can start to address it. So with that, I'm going to open the floor. Hi, Dr. Kogan. Welcome back.
Hello, Samira. Thanks for having me.
Well, thank you for coming back. We really appreciate it. And I'm hoping to just start there. So maybe we just start with, how do you define stress? How has it shown up in your work? Maybe you can give us some sort of like structural framework to understand
Yeah,
that
I
very
mean,
loaded term.
we have to define it because part of the problem is that stress means it's a huge umbrella term for like a million things. And in the context of cancer, I want people to think of it as activation,
Hmm.
activation, and in some ways, chronic activation. So I can either be activated because I'm stimulated by an event outside, like, a diagnosis of cancer. It just happened, this week. Someone thought they had an abscess or they didn't feel well, and they went to the doctor and they have metastatic cancer. So the shock of that's stress. So like this explosive event, but it also happens, from pressure from inside. So I really like the physics definition, which is like a force applied to a surface area. So that's how I think of it for myself. So when I say, oh, I'm stressed, then I literally think of like, oh, what's either pressing from the outside and what's pressing from the inside. And 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 so everybody has to kind of define what does that mean to them. And then once you say, okay, something presses from the outside or something presses from the inside, how does it affect me? And that's important, so we actually have some self-regulation or some, at least a chance at doing something about it. So for example, when I'm stressed, it really affects my thinking. So in our family we have a rule: there's no decision making if we're stressed. We can only make a choice based on feeling calm. And so for me, it affects thinking. For other people, it affects emotions. They become all like agitated, or angry or cry or sad, or, it's a very, tumultuous emotional experience, or affects behavior. So people are stressed, and in cancer care, that's important. They often rush to decisions. They're so freaked out that they need to find the solution that they
Yeah.
take action without really having thought through things. What's the cost benefit? What does it mean for me? Can I live with the downside? The whole range. So everybody can go inward and define for themselves, if they don't like my pressure from the outside, pressure from the inside definition. Um, what does it mean to them? And of course, it comes with this chemical rush of, adrenaline and all the stuff everybody is now talking about. But what does it mean to you? And what's the entry point so you can actually do something?
Um, can I'm going back and forth on maybe two threads that we can. Thread one is, in the broad definition of stress, you have external or internal stimuli. I think you mentioned that your sort of impact of the stress is cognition changing, I
Mhm.
think for me, I've fallen probably into the emotional bucket, but it's
Mhm.
pretty much directly anger for me.
Mhm.
I go almost straight to anger when I'm stressed out. Um, so understanding that broad framework makes sense to me. I guess what I'm trying to figure out is what makes the cancer experience different than an external stimuli, say caused by, I don't know, a heart disease or caused by a diabetes diagnosis.
Yeah, so there, in all fairness, I'm not sure from an emotional or cognitive
Mm,
or behavioral perspective, it is that different. Because people who live with chronic heart disease, they are sometimes constantly at the threat of dying from cardiac arrest. Some people need
mm,
to have a stimulator implanted so they don't just drop dead. So they have to live
mm,
with a very similar uncertainty. But societally, cancer has this, and we touched on that last time. This deadly connotation. Cancer means death. And this day and age, that's not true. I think I mentioned those numbers. 70%
yeah.
of people live at least 5 years. And so it's really a societal leftover
Mm,
of a mindset. But I've worked with people, with heart failure who are at a constant threat of dropping dead from an arrhythmia. It's
mm.
very, very scary. So the uncertainty is very similar. It's just not as talked about it as much. Um,
Huh. There was something you just said that I think it's worth us maybe spending a few minutes on, which is it's leftover mindset. And I would love
mhm,
to talk about that a little bit because as a uh, as a survivor, I see it all the time where women get diagnosed with super early stage breast cancer or sometimes DCIS, stage
mhm,
one.
mhm.
The treatments are phenomenal, and yet the emotional impact of that experience and that diagnosis is very profound.
Mhm.
And I'd love for us to spend a bit more time unpacking that. Like, is it that we're not talking about it in the right way? Is it that all of our language around cancer is all about quote unquote cure? Like the race to cure. Like there's a lot of language in here that's used, especially I think on in the US,
Mhm.
that propagates this notion that cancer is a death sentence.
Yeah, like cancer, like stress is this umbrella term. Like the word cancer, I don't know, there may be 1,000 diseases in that, and not just the phase of the illness or the stage of the illness or the type of illness.
Yeah.
And so I don't know how to change that because the personal
Mm.
experience taps into uncertainty one way or the other. So if you have
Ah,
CIS or
yeah.
metastatic cancer, you have to live with uncertainty.
Mm.
With someone who is cured, quotation marks. I know I'm not supposed to say that, but there is a cure from cancer. It actually does exist. Um, the uncertainty of it coming back
Mm.
is very activating. That evokes, to use the word stress that I don't like that much, but for the
Mm.
lack of a better definition, let's use it. This activation was like, okay, is it coming back? What am I going to do about it? I don't know how I got it to begin with.
Mm.
I didn't do anything wrong, and now I don't know what to do about preventing it from coming back. So this uncertainty of like,
Yeah.
how did this happen to me? Does it have anything to do with me? It's also an attempt at, oh my goodness, is there any action I can take? So I think that's really more an expression of the uncertainty.
Mm.
How to change the fact that cancer is just an umbrella term for a lot of illnesses. Honestly, I don't know. I mean, some personal advocacy of someone who,
Mm.
I talked with someone the other day who has metastatic cancer, and she says she hates all these books that say, you are over cancer, and then how was your treatment, and, blah, blah, blah. And she says, well, my treatment will never be done. I will. get treated for as long as I live. So she wanted something specifically for her bracket. But from an uncertainty perspective, it's not that different. I
mm,
now live with cancer and I don't
mm,
know how long I'm going to
mm,
live and whether I die from it or not. Many
mm.
people with cancer do not die from cancer, they die from something
Right.
else, like, a heart attack. So and there's
Oh,
something
yeah.
else. You use the word survivorship. From an uncertainty perspective, I'm the one who claims it's not that different from other illnesses.
Mm,
But we don't call someone with diabetes a diabetes survivor. Someone who is on dialysis in connection with diabetes has not a you know has a,
mm,
statistically speaking, challenging lifespan. Not that
mm,
different from some people with cancer, but we're not talking about a diabetes survivor. So there's something around the societal, cancer uh,
mm,
mystic that I personally would like to change. That cancer is an illness like a heart attack, a heart disease,
mm.
or imagine someone who lives with chronic pulmonary fibrosis. It's a incredibly uncertain way to be, and it has an increased mortality from a lifespan perspective. I feel like all these illnesses deserve to be treated similarly.
Yeah, and I maybe a controversial statement that I may get a lot of flack for from the cancer community, but I think I share that sentiment. And the reason I share that is a fewfold. One, I grew up, my mother had, this was many, many years ago, for no fault of her own, ended up getting hepatitis C
Hmm.
because
Hmm.
she got blood transfusion from the hospital. They weren't screening for it. She and a whole cohort of Indians, because the blood banks were not screening for it, ended up getting hepatitis C. Now, hepatitis C is not, you don't get chemotherapy, but the treatment back then, before the new drugs have come out, was not easy.
Hmm.
And it has long-term side effects on your body. It really does destroy a whole bunch of your body. And part of the problem with that was no one was talking about it. She had no support group. She had no community. She had no, there was no advocacy around it. It was navigating the uncertainty of the illness and then doing that in isolation.
Hmm.
And the controversial statement I was going to make is, in the cancer community, yes, there's all the navigation of the uncertainty, but to a large extent, we do have community. And I keep describing this, like, you get diagnosed with you get diagnosed with cancer, you get this like exclusive membership to this club where you belong for the rest of your life. And you do get this exclusive membership, like that you do get that. Whereas with a hepatitis C diagnosis or a heart disease diagnosis, I don't think you have kind of
Yeah.
exclusive
So
membership.
So to their help protect you from the wrath of the community, I, I must add that that's your privilege of youth. So
Mm,
20 years ago, I don't think many women with cancer would have made that statement. And so when I entered this
mm,
field, people, I mean, to this day, people don't quite understand what I do. So how I fit into the radiation, chemo, surgery, immune therapy piece.
mm-hmm,
And so I maybe again I'm making a societal statement that might or
mm,
might not be true, is that there's something about cancer that has now led to more advocacy
mm,
in terms of creating groups of
mm,
belonging. I mean, we're also talking about millions of people. I mean, I know hemophiliacs that have HIV based on what you just said about your mother and Hep C, that were infected through their transfusion and now have to live with this still,
yeah.
unfortunately, stigma of how they got HIV. But it's not millions of people.
Mm,
Um, and so, but I don't know if quantity makes a difference. But I'm glad
mm,
there is now community. But if we want to advocate for everybody, who survives something,
mm,
then let's include the millions of people
mm,
with lung disease and heart disease and diabetes. But I will not call them survivors.
mm. I think even the cancer world, though, whatsoever, has its own share of like
Yeah, I
um,
mean it's now an established term,
problems.
and it's
Yeah,
from beginning of diagnosis.
yeah,
But then let's call everybody a survivor.
yeah.
I'm a survivor of humankind.
No, I think your point on the 20 years ago is very, very true. And I think for a lot of the reasons, a lot of our listeners are in the US and in India, and a lot of my comments about community are more US centric.
Hmm.
Like if you think about India, we're not there yet, right? I keep making this joke with the, not joke, but I keep making the statement that says, the pink ribbon movement that happened in the US that really did change the trajectory of, I think, societal understanding of breast cancer to a large extent, has not happened in India.
Hmm.
And we don't have that sort of awareness yet. And the challenges we see back home in India are different than the ones you see here. And so I do think that my comment about community was very US centric in making it, but I think you're right that 20 years ago, that was, I don't think we would have ever said what I just said sitting here
Yeah,
today.
and so I'm very glad you can
Yeah.
say it, and I just didn't want us to get an angry email from an older cancer survivor who lived all this in isolation and loneliness.
So actually, can we maybe go there? Because I think there's something about isolation and loneliness that I think is still true in the cancer experience, despite having community. And I'd love for us to unpack that a little bit, right? Because despite having community, despite having societal infrastructure built up in the US, maybe not across all states in the US, but largely in the US, we do have access to support groups, etc. There is a lot of isolation, depression, mental health impact in the cancer space. So I'd love for you to maybe touch on that.
Yeah, I mean, that links us back to the word stress, because that activation uh, really, I want to say, mimics depression and anxiety. And now I'll
Hmm.
be the one who gets the angry emails. I'm not saying, people, oh my goodness, it just starts hailing out here.
Oh, wow.
Oh my goodness.
The
So if
weather's
you hear
been,
a sound in the background, that's what this is. Um, I lost my train of thought. Uh,
we were talking
well,
about,
yeah, so the words depression and anxiety, I'm not saying people don't have feelings of fear or, what comes with how we use the word depression, of having low energy or thinking being affected. All of that is true.
yeah.
But it is usually, in the
Hmm.
vast majority of situations, based on this activated stress that affects
Hmm.
emotions and thinking, and it mimics what we conventionally call,
Hmm.
depression and anxiety. And that's a take home message I really want people to hear. So, the referrals I used to get were for depression, anxiety, adjustment disorder.
Hmm.
And I would see, the patients, and they were just lovely people, but they didn't have that diagnosis, but they were incredibly stressed. So there's a whole
Hmm.
movement within the cancer community to
Hmm.
look at cancer through the lens of the the
Huh.
stress, rather than mental health. And by no means do I want anybody to hear that I'm ignoring the mind aspects, and if anything, I'm advocating to help people, but not under the umbrella of these conventional psychiatric diagnoses. Um, I want people
I'm,
to,
yeah.
yeah, no, go ahead.
No, no, it actually, what you just said has been mostly a hypothesis of mine for the last maybe year or so, which is why we actually, on Manticares, we offer coaching. Because what
Hmm.
I began to realize was, and this is not science based on my end, this is just purely experiential on my end. But I began to realize that my mental health, traditional mental health, so from the therapy land, from CBT land, cognitive behavioral therapy land, I kind of tapped out. Like I stopped finding value in that modality during my cancer experience. And there was something about it that just was not fitting anymore. It was not giving me the benefit it had prior to the cancer diagnosis. And that's one of the reasons why we started offering cancer specific coaching from trained professionals, but those who are survivors, right? Those who have had the direct experience of going through the cancer experience. And it doesn't fully address what you're talking about from the stress angle of it, but I think that notion of the experience of mental wellness under the cancer umbrella is distinct from major depressive disorder or the sort of traditional mental health disorders that we see or the diseases that we see out there. I think it is a fairly important one, and I personally have not come across, except for you, people who.
Yeah, I mean there are an emerging community that points that out. I mean there was a effort at the cancer center, to implement, and I think it's now being done in several cancer centers to assess people's distress when they come in, and not just in the category of being cancer and illness based, but spiritually, financially, professionally. I mean, all columns of our existence are challenged, but the need was huge. I mean, it was like 60% of people reported some kind of distress, and then we had no vessel to capture it. So the social workers have done a wonderful job at addressing some of the pieces, like financial work and all these things, but the distress component on the brain, and other parts of the body, we just don't have enough qualified people. But it is growing. People are more aware of it. There's research that shows it. And
Yeah,
again, I don't want anybody uh, to hear me say that this is against some mental health advocacy. Not at all. I just want people to think less in categories. We're obsessed with putting everybody in a little box, and if you put someone with cancer distress in a mental health box that was designed
yeah,
for different population, you just miss the actual problem, and so you don't address the actual problem. To your, we started this conversation about isolation and feeling lonely. That adds insult to injury. Is here you have this devastating situation to deal with, and then someone tells you, well, on top of this, you have some kind of disorder, when it's really an adjustment. It's People have to adjust, and it takes time and support. And with respect to cognitive behavioral, the idea I have an insight, cognitive, and then it helps my behavior is, works in some situations. But as I said, thinking can be so distorted with stress. Everything, the way I perceive, the way I interpret, the way I execute, the way I retrieve, the way I store. I mean, nothing works. Then, the insight is slightly flawed. And, I can have insight and it will not change behavior because my brain is frozen.
I have my head is like buzzing now because there was something you just said about why CBT sort of has a sort of it doesn't necessarily always work because your cognition is impacted because of the stress. Your cognition is also impacted because of the treatment.
Mm-hmm. Yeah, very good point.
And
Mm-hmm.
until you said it, it didn't occur to me that both are happening at the same time.
Mm-hmm.
And sometimes you're on treatment for years.
Mm-hmm. Mm-hmm.
And uh, like I know that treatment definitely affected my cognition,
Mm-hmm.
definitely during, and I would say there are lasting effects for me, but that's just again personal experience. Um, and I think that's hard too.
Yeah, that's another cause of isolation, because for a long time the oncology community did not acknowledge that. It is now recognized also. I mean, there are people
Yeah.
doing research on it. And it's quite obvious, a before and after effect. But when I started out, this was the famous "it's in your head"
Mm,
comment. So people, would
mm,
comment on their chemotherapy effects, and they would last, and they, had to adapt professionally, in their relationships. There's this
yeah.
reset of adaptation, and to then hear, well, it's just in your head. Basically, you're imagining it. Yeah, it's in your head, but not because you imagine it, but because your brain is affected. So again,
Mm,
that's a
mm,
unfortunately growing acceptance. I mean,
mm,
most cancer centers now have, something attached to them, the bigger ones that address these kind of psychosocial,
yeah.
you know, sources of alienation for patients. But not everywhere. And as we
Yeah.
said, I mean, culturally, uh, it's growing here, but in many parts of the world, it's very different.
Dr. Kogan, can we maybe go back to cancer vis-a-vis non-cancer diseases? So heart disease, just because we've been talking about it. I'm gonna throw out a hypothesis here. Um, Part of I think the hypothesis is in heart disease, we are at a point where the research is fairly clear on what might cause it, how to intervene after it, and what to do to reduce your risk. And with cancer, I don't know if we're at a point where, and there are exceptions to this. I do think in some cases we have positive
Mhm.
elements, but in a lot of cancers, we're not at a point where, like, my oncologist could not pinpoint and tell me this is exactly what caused your cancer. And I think in the absence of something where you know what the quote unquote cause is, and thereby you know how to intervene, both acute intervention and then long term intervention, I wonder if the level of uncertainty is just much higher in the cancer experience than in non-cancer disease states.
Yeah, I have to give that some thought. It's an interesting thought, the idea that cancer has more uncertainty attached to it, and it's true. I mean, if I now think of heart disease, it's not as simplistic as people make it out to be. It's the cholesterol and the high blood pressure, and all these things. They just shift your risk assessment. And to take a provocative example, like in cancer, we don't know, but if you look at lung cancer, so 90% of people with lung cancer are smokers, but only 10% of smokers get cancer. So, and I don't hear that as an encouragement to start smoking, but 90% of people who smoke don't get cancer. So,
Right.
obviously, there's some mysterious constellation environment and genetics and predisposition and circumstances, and it's a very, very complex package, and that's why it's so important that we don't
Mm,
misattribute in these simplistic terms. But because of your uncertainty and the
mm,
difficulty of dealing with uncertainty, we need that. So rather than say,
sure.
well, I don't really know what caused my cancer, it
Mm,
probably was
huh.
10 different things. That
Yeah.
totally leaves you in the uncertain, because then you can't do anything about preventing it to come back. So this
Mm,
obsession, with this monocausality attribution, to me is an expression of the inability to deal with
mm,
uncertainty. And
mm,
if we talk about heart
mm,
disease, people also don't understand the data. If someone comes and says, "Oh, I have a low heart rate variability, and now I need to, get an echo," I'm like, no, like, like, how do you go from here to there? Uh, the data
mm,
points are complicated.
Hmm.
So can you sit there
Hmm.
and say, okay, something happened
Hmm.
and I am now in a very, very uncomfortable situation, and I do the best I can. But I also learn to live with the uncertainty rather than misattribute cause and effect. But it could be
Hmm.
that as a society, we do that less because it's just
Hmm.
with heart disease, because it's just easier to see like a vessel go to the heart and it's clogged up because of too much cholesterol and high blood pressure and sugar and
Hmm.
age. Yeah, it's an
Hmm.
interesting notion. I mean, maybe we'll hear from the audience also
Hmm.
from a multicultural perspective
Hmm.
what to do about it. What I do know is we have to learn to tolerate uncertainty.
Hmm.
No monocausality misattribution will help us with that. Zero.
So how do we deal with uncertainty?
Okay. All right. I haven't successfully found the recipe, but T.S. Eliot helps. He says humans do not tolerate much reality. And, and so that's that's an entry point into, can I
Hmm.
tolerate, I'm
Hmm.
saying it jokingly, but only half jokingly. I mean, I quote that a lot. Can I tolerate my own reality? A reality with cancer is really tough. I mean, I constantly have to make
Hmm.
choices and have to think about
Yeah.
it. Does this work and this doesn't work? And who said this? And what does it mean? And I mean, it's this constant tumultual existence, and it's very unsettling. And I'm an advocate for the self-regulation of thought. A problem with uncertainty is that it's fueled by fearful thinking.
Hmm.
As I know from myself and yeah, many other people with or without cancer, thinking really gets out of hand.
Can
Um,
you give us an example of that, just to make it more concrete? Like, what do we mean by that? Like, um,
yeah, like, I mean, if we take an example from the cancer world, so I have a history of cancer, I mean, a fictitious eye. And my surveillance scan isn't scheduled until 6 months from now, and I have a pain in my arm. So, what's this pain mean? It could be
hmm,
I bruised myself, or it could be, you know how that goes from experience. And then the mind
definitely
goes,
been there.
yeah, and the mind goes to, oh, I know it's cancer. But then, the next
Yeah.
step is, oh my goodness, if it's cancer, then, let me talk with my family that I'll be dying soon. And then, you talk with your family, and then they're freaking out because, that's not where their thinking is, because in their thinking, it's a pain in the arm, and they don't even want to think about that it's cancer. And then you end up having an argument. And, everybody is then, having a argument at the dinner table whether or not to push up the surveillance scan, just on the inability. And I'm not saying it's easy to sit there and say, I don't know what this pain is. It might or might not be cancer. It's low probability that it's cancer. Um, and do I want to wait for 6 months?
Hmm.
So that's an example where,
Hmm.
uh, yeah, or an example that we took from the thinking. So I come back to work and my brain isn't working. I'm not as sharp, I'm not as quick, I'm not as whatever. And I don't take a deep breath and say, okay, let me tolerate this moment. What can I do and what can I not do?
Hmm.
oh my goodness, they'll find out that I suck and I'll get a poor performance review. And then I have three of those, and then I'll lose my job. And not just will I lose my job, I'll end up under a bridge, homeless. That would be, and that's all I have heard. All of this. This is not, I'm not making this up.
No, no, I know you wrote all of this. I've definitely had my emotions of what you were talking about.
And, nights are hard. That's nights when there is no way. And that's a recommendation to people when they
Mm,
feel like their thinking
mm,
is getting out of hand to
ah,
shift their focus onto a focused attention. It's very hard to do your taxes and focus on, the despair of not having anything add up the way it should. And have, you know, have the fear of uncertainty. Or
I'm laughing just because my morning was definitely what you just described with the death.
yeah.
But more importantly, can you describe focus attention? I'm not sure everybody in our audience would know what that is.
Yeah, so the brain has different networks. One network is an attention network that just kind of takes it in, and then we got to process things. And focused attention is the part of us that zeroes in on an activity. So, let's maybe take something more pleasant than taxes, like yoga. Yoga is a focused attention activity. So your focus is on, I got to stand on one leg to not fall over. I'm supposed to
Mm,
breathe while I'm doing that. And there is no, the brain's capacity for idle thinking, what the default network does,
mm,
is eliminated because all the bits of
mm,
processing speed are on this attention. You and I
mm,
right now, we're focusing on each other. We have to focus on, are we reasonably coherent in what we're saying? And, does it matter to the audience? Or,
yeah,
those are all focused attention things.
mm,
And the default network activity where the brain literally just engages in almost random, but it's not random thinking,
mm,
that can be a pleasant version, like daydreaming. If you drive down the street and looking out the window, that's also default network activity.
mm,
Kind of presumably random thinking.
mm,
um, and so I always recommend to people, and again, I'll probably get the sleep community on my back, that says you shouldn't be getting up at night when you can't sleep. I'm like, why not? So, because if I lie there and
mm,
have unpleasant thought content for 2 hours, my
mm,
body doesn't like that at all. So, a little focused
mm,
attention of reading or doing the dishes I didn't do the after dinner. I, until the body gets tired. Uh,
mm.
there's nothing wrong. Keeping people tied to their beds for 2 hours of a sleepless interruption is very stressful, to use that word again.
I feel as though I just learned something about myself. This is very profound. I don't normally have realizations about myself in the podcast. But if you're okay with it, I may share something.
About the focused attention, or
Huh? And the sleeping part, because I think you're right. Nights are really hard. The nights were the hardest. Those were the hardest parts of the day during cancer. Like active treatment, that's what I meant. I mean, during the day, I was working full time,
Mhm.
so there was plenty to keep me not focused on the cancer experience. But at night, when my family was sleeping, I was in bed. I was not tired enough to go to sleep. I would sit and read papers, and I would sit and read abstracts, and
Mhm.
I would read papers because for me, I like the science. I like the data. I want to know more. I would just, I probably spent 2, 3 hours reading. But it was reading on cancer. So
Well,
it was
that
not,
I might
I
not
don't think it was
necessarily recommend.
practical. I know that was not a recommendation. That's how I was like self-soothing. And then
Mhm,
when treatment got over and that phase kind of passed where I didn't need to read as much, or finally realized that, there was a detrimental effect to me uh, reading at night, in like, reading that content at night. uh, I actually need something, like I almost need an activity the last 10 minutes before going to sleep. I find it very hard
mhm.
to fall asleep if I don't have activity just before bed, like while I'm in bed. And I think your example of focus attention helped me understand why
And
that
you
may be
can
the case for me.
specifically use it. I mean, we're talking
Hmm.
about, what
Hmm.
can we do? So there's this distress.
Yeah.
Nobody denies it, or hardly anybody denies, the existence of distress with cancer. But now what? And so this entry
Yeah.
point, can I do something about my thinking?
Hmm.
Can I do something about my emotions?
Hmm.
Can I do something about my behavior? And there, I always want
Hmm.
people to see it in the context of, am I doing these things as a representation of uncertainty and feeling out of control?
Yeah.
Cancer is an out of control experience, and no humans like that. So we want control,
Hmm.
and there are things you can control.
Hmm.
You might not be able to
Yeah.
control every single cancer cell in your body, but you can, to some degree, control emotions and your actions and your thinking. And
Hmm.
so that's where,
Hmm.
thinking for me is almost the hardest candidate, of saying, okay, I shouldn't
Hmm.
be thinking this. I should think positive, and then you think some other crap. I mean, that's now a real life my situation. I'm not imitating anybody. I do that. I think a lot of crap. So I specifically
Hmm.
focus my attention on something that doesn't allow
Hmm.
the default network
Hmm.
to blabber away.
Hmm. Hmm. Um, Can we then maybe move to? I know that a lot of the times you use the body as well, right? You use breathing techniques, you use the body, maybe to for uncertainty, but maybe to do other things too, to sort of shift focus, to shift your attention. Can we maybe talk about the use of breath or other aspects of your physical body?
Yeah, so I specifically do that. The people always talk about mind over body, and that's not a philosophy I follow. It's for me really body over mind. So, I sent you this little joke where you see someone sit on the sofa, and you know the mind says get up, and the body says no. And that is a cancer predicament. I hear that all the time. Oh, should go for a walk, or you shouldn't be eating this, or la 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 la. And the mind is very expressive in its demands, and the body's like, no thank you. I can barely go to the bathroom. I'm supposed to go for a walk. So I flip it. What is the body capable of doing? And something it can always do, or most always, is breathing and breath. And I know this is still presumably fringe science, even though it's very solid science. But for many people, it's still fringe science. The the lung and the heart and the brain are very closely linked through the vagus nerve. So how I breathe doesn't just affect my heart; it also affects how I think. So that's where this rule comes in.
Hmm.
In our family, we're not supposed to make any decisions. I'm laughing because we don't always follow that rule, but we follow it for the most part. Um, we have to get calm before
Hmm.
we make a choice, and so we have to breathe away because that's the most effective way to get calm. And that's been pretty solidly researched, that if you breathe roughly the frequency of like 6 breaths a minute, that's 10 seconds per breath, that's the most calming effect on the autonomic nervous system. And again, the breath researchers now will be up in arms about me saying that, but they'll probably also be happy that I even talk about breath. they don't have to be too specific if it's 5 or 7 or 6 breath. But long story short, when you inhale, just make an effort at extending your exhale, and you can feel it. If you breathe in through your nose and then gently breathe out through your mouth, just give it a little extra, second or two. And that's quite effective when you practice that. You can actually feel it within a minute or two. The body just shifts. However, it doesn't work if you think at the same time. So people are often very self conscious. They take a breath and then they say, "Oh, I'm doing it wrong," or "My lung isn't expanding," or "My diaphragm isn't moving." So they have a lot of mindsets around it. And then I'll ask them to, again, just focus on what's called the interoception, on the body signals. Put your hands on your chest and your belly, and then just pay attention to the hands, how they move when you breathe in. So I'm adding some, interoceptive or physically oriented activity, again, to crowd out the chatty part of the brain. And if that's still not enough, then I might have them stand on one leg and do those breaths, because the cerebellar part of the brain that keeps balance, if you don't do yoga, it crowds out your ability to think. I haven't met many people, unless they do yoga or tai chi or something, that can stand on a leg, focus on 6 breaths a minute, and can still think.
Very, very cool. Okay, so so far we have two techniques. We have focused attention, and the use case there is if you're sitting you're at night, you're not actively doing taxes or some other work, you can choose to do a activity, reading, dishes, something that sort of focuses your attention onto your body and your mind. That's one. The second is fairly simple breathing, and that breathing is 6 breaths, roughly 10 seconds each, so about a minute for 6 breaths. Inhale and then long exhale. And if the brain keeps chattering away or the mind keeps chattering away, then you can use your hand on your chest, monitor your hand. And if it doesn't work, then stand on one leg and do the same thing. Is that
Or
right?
do a plank.
Do a
Not
plan.
many, not many people have core muscles. And again, you can't do that when you go through chemotherapy, but think of an activity that limits your ability for the chatter brain to be active. And if the chatter brain, to add a third one, the exploration of the chatter brain. So all these signals, like thought, are an expression of the brain of signaling. So if you say, "Oh, should I do the scan, or should I move it up a week?" or this thinking around behavior, take a breath and say, "My brain is chattering to signal my desire for question mark." What emerges in terms of a word? I really want to get the scan now to fulfill my desire for. And just let a single noun emerge. What could that be? And the words that are very consistent that come up for people are certainty, control, predictability, and yeah, you can move up the scan if that helps alleviate your fear, but it will not teach you, how to live with predictability or uncertainty. And there I say, can you take a stand-in action? If you've now accepted I'm not moving up the scan, what else gives you a sense of certainty or predictability? Take an action based on the need that you're trying to satisfy. And the body is really happy when you do that.
What's an example of that?
Well, we talked about I don't know. So some people, when they're diagnosed with cancer, they notice that they do a lot of cleaning and sorting. All of a sudden, closets get organized, and so that's an example of organization, which is a form of control.
Interesting.
And you can be specific about it. You
Mm,
don't have to kind of let the body take over. Say, okay, I can't have control right now in this area, or I haven't succeeded at controlling this appointment, or I haven't succeeded in getting
mm,
predictability of my situation. But you can fulfill a stand-in need like organization or
mm,
structure, and
mm.
there's some things you can create that create predictability. And that doesn't mean you're not taking that other need not seriously. We're talking right now about the body
Yeah.
and how to help her or him or them to to kind of rein in their mind so it doesn't run away like a freight
Mm,
train.
mm. That is incredibly profound. I think that makes a lot of sense to me. And I think that's actually a really good place to sort of wrap up the episode today, because I think we started this episode by talking about stress, defining it in a very general way that we can apply to the many cases. We spoke about the specificity and non-specificity of the cancer diagnosis, the cancer experience vis-a-vis other conditions. We spoke about the manifestation of uncertainty and how that really is, like, we didn't use the word trigger today, but it really is an activation that happens kind of throughout the cancer experience. And then we unpack maybe 3 techniques that people can use that can help them navigate uncertainty, kind of regardless of where they are in the cancer experience. Um, is there anything I should have asked you that I have not asked you that you would like to share?
Well, we can have 5 more podcasts.
Fully believe that.
It's I just hope that there is a little piece in what we have discussed, and presented that people can translate into something practical. That's really my hope. It's uh, yeah, no, I appreciate your questions and how succinct you are, and obviously come from a place of experience. But that's my hope. Is there something that a light bulb says, oh, I could do this? Or like what you said, oh, I understand why I was reading papers at 3 o'clock in the morning. Some illuminating, expanding awareness, really. We come from a place of expanding awareness. We have more tools to act in that place of more awareness, things that advocate for health. I always say, don't just focus on illness, focus on health. Um, there are many parts of you that aren't diseased when you have cancer. Take care of
Yeah,
them also.
that's a very very profound thought, and I think that's beautiful. And on the practical insights, Dr. Kogan, that is actually our mission too. So with every episode, we try and end them with the practical takeaways that someone can use in any aspect of their life. And I think for us, it's actually really important to achieve our mission. And our mission is not some lofty mission of curing cancer or eradicating disease. It's to make the cancer experience just a little easier. It's a
Yeah.
very, very low bar, but that I think that just a little easier, I think, can make a huge difference, because there's just a lot about the experience for cancer and non-cancer that is very difficult given the many constraints that life throws at people. So
And I might just flip that language. I would
I'm
I
ready.
would call that, rather than make it easier, because it isn't easy. We make it less hard.
True, true,
It's
absolutely.
it
We
per
can make it less hard.
definition it is hard, and what we can
Yes,
contribute hopefully is to make it less hard.
yes.
I wish we could make it easy or easier, but there's nothing easy
Mm.
about having cancer. Just nothing.
That is totally true. I
Yes.
think that is completely true. I think I like the reframing.
All right.
Thank you for joining us again. We appreciate it. And we will figure out a way to get you back for 5 episodes or however many we need to actually unpack all the wealth of your book.
Well, it'll be interesting. You'll get feedback and also, express what people need. It
Yes.
raises question, and there's something about individuality. It's like everybody has their own experience, and it's not a cookie cutter situation. So
Yes.
people will raise questions.
It's perfect.
All
We will
right.
do that.
Thank you very,
All right.
very much.
Thank you for joining us.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The content here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.